Welcome to Caring for Patients with Down Syndrome, a professional development series for health providers, brought to you by the Down Syndrome Association of Greater St. Louis. Today we will discuss catatonia and regression.
Hi, I'm Janet Strate. I'm the parent of a 24-year-old son who, in the past 2 years, was diagnosed with catatonia. Catatonia is part of the Down syndrome regression disorder, which could include an autoimmune component or catatonia. It was a long journey to diagnose the catatonia. We saw many doctors, and it took over a year to get an appropriate diagnosis for him, to get him on the road to recovery. I'm here today to discuss what exactly catatonia is and how it may present in a patient that you may actually see in your practice. The first question is always, what is catatonia? There are a number of symptoms that a person with catatonia can have. They may stop moving. They may freeze in place. They may have rigid body posture or remain in one position for an extended period of time. They may actually stop talking. Our son stopped talking and began using sign language as his only way to communicate with us. They could become very agitated or grimace. This facial grimace that our son has may make you think that he is in pain. Nope, he's not in pain. There's just this frozen grimace that he'll have that it takes almost a minute for him to work out of being in that grimace state. The diagnosis process of determining if our son had catatonia took quite a while. Initially, we were ruling out what it wasn't. We determined that he did not have a problem with his thyroid, which is common with people with Down syndrome. Additionally, we also looked at autoimmune conditions and had a full evaluation to make sure he did not have any autoimmune problems. We started with a physical by his primary care doctor. Then we went through to ophthalmology, ENT, just to make sure there were no vision problems, that he could actually hear. There were no problems with his ears. We had an MRI of his brain, a sedated MRI of his brain, and an EEG to determine if he had any seizure activity. The blood work was quite extensive, again, just to rule out all of the things that it could have possibly been of what was wrong with him. The next step was to review symptoms with a psychiatrist, and we used the Catatonia Impact Scale. In reviewing the Catatonia Impact Scale, we did determine that our son had many of the symptoms of catatonia, and the psychiatrists we saw felt that it was a good thing to begin treatment. With the line of treatment being initially Ativan or lorazepam, he tried a very high dose of lorazepam given throughout the day. Unfortunately, he reacted as anyone would on lorazepam. He was sleeping all day long. So the next thing to try was electroconvulsive therapy. If ECT is recommended, many doctors or hospitals will also have you go through a secondary review, just another set of eyes as a precaution. Additionally, if the person has a legal guardian, in the state of Missouri, the probate court must approve any treatments, which means that the hospital, doctor, and the family are going to probate court, normally through Zoom, to get permission for treatments to begin. If the line of treatment suggested for the patient is ECT or electroconvulsive therapy, it's always important to put the family at ease. Most people have seen the movie One Flew Over the Cuckoo's Nest, and it's important to assure the family that treatment for their loved one is not like the movie. It is absolutely nothing like the movie. The person is sedated for the procedure, and they will not feel anything. There is a possibility of short-term memory loss. However, our son never experienced any of the short-term memory loss. Initially, when they begin the procedure, for ECT, they will begin unilaterally with a 40% charge, gradually working up to 100%. And it's increased based on seizure activity. If there's no improvement unilaterally at 100% after several sessions, they will begin bilateral treatment, again, moving down to 40% and gradually increasing to 100%. We actually saw improvement bilaterally once he got to 100%. It took probably about 5 or 6 treatments before we began seeing improvement. The initial improvement we saw was that our son finally started smiling, and he actually started talking and responding to our questions. After ECT, the person will recover in the recovery room from the anesthesia, and they can normally return to their normal activities the next day. I think it's important for any doctor that has a patient with Down syndrome that's presenting with possible catatonia, take it seriously. Understand that the family is communicating to you that their quality of life has changed, that this person is suffering even though they may not be feeling actual pain. Don't disregard it as, oh, it's simply Down syndrome, they're in their 20s and they all slow down. That's not it. Our son was a high functioning person with a Down syndrome that was enjoying life to its fullest. He was very independent, doing almost all normal activities on his own, and really wanted very little input from his parents, fairly typical of a 20, 21-year-old. When he started regressing, it was quite sudden, and our life actually had changed dramatically. His morning routine went from half an hour to get ready for school and work to 2 and 3 hours to get up in the morning and get breakfast. Evening routines, what should be a fairly straightforward, have dinner, go get your shower, and put your pajamas on and go to bed, it should be fairly straightforward, 1 to 2 hours. Our nightly routine became 5 and 6 hours. He was taking way too long just to even get up the stairs to begin the nighttime routine. His life had changed dramatically, his quality of life. We think it's important that the doctors take it seriously and not just discount the symptoms that they're hearing as that's simply Down syndrome. Many families, when they hear ECT, are going to be terrified. We were terrified, questioning whether we were making the right decision or not. It's important to work with the doctors and the nurses to help your loved one calm down and understand that this procedure will help them. Our son loves music, he loves rock music, and so the nurses were instrumental in making sure that he felt comfortable. They asked him what his favorite music was. They played his favorite music in the pre-op room. The doctors and nurses know that when he walks in with his favorite rock band t-shirt, what music they're going to play, which actually helps keep him very calm so that they can begin the pre-op procedures with him. He now goes in by himself, and he's very excited to see the nurses, and he even can tell anyone when his next treatment is. Thank you for your time, and we're very happy that you're able to spend some time learning about catatonia and Down syndrome.